Hi, everybody. Welcome to the webinar today. We are talking about reversing Alzheimer's, the clinical approach. I am Dr. Mana Sembe.
And I'm Dr. Heather Sanderson.
And as some of you may have attended our previous webinar last week, which was on Marama. And today we are going to talk more about the approach we follow at the clinic here at Solsere. So we are excited to take you through this. Okay, one of the first things we want to talk about is the statistics about Alzheimer's disease as they exist today. Now, this is a graphic from Alzheimer's Association, and it gives us a lot of very useful information. So you can see that 1 in 3 seniors will die from Alzheimer's or a related dementia. Alzheimer's disease kills more than those affected by breast cancer and prostate cancer combined. There's more than 6 million people today with Alzheimer's in the United States. And very interestingly, in the last 20 years, the deaths from heart disease have decreased 7.3%, but the deaths from Alzheimer's have increased 145%. That's a huge increase. Something else to keep in mind, Alzheimer's and dementia deaths have increased 16% during the COVID pandemic, started March of 2020. And then there are some statistics over about how many people are involved in caregiving for people with Alzheimer's. There's over 11 million Americans that are doing unpaid work to help those affected with their activities of daily living, and a large number of dollar amounts that would amount to. So just very sobering facts and a good place to start our discussion today. Next, we want to talk about the problem with the nomenclature of dementia. And this is one of Dr. Dale Bredesen's favorite things to talk about these days, to educate the general public that the naming of the stages of dementia is actually a problem. And you'll understand why. The first stage is it's called what we call the pre-symptomatic stage, where the changes in behavior are not obvious, but you can see changes on the PET scan and a scan of the spinal fluid. The second stage is called the SCI, or subjective cognitive impairment. Now, this lasts about 10 years. And during this time, it would be very easy to reverse the decline, but most people don't do anything about it during that time. The next stage is MCI, mild cognitive impairment. And this is where it gets really unfortunate with this terming of this term, mild cognitive impairment, because people think it's just mild, it's normal, I don't need to do anything about it. However, this is a stage which occurs relatively late in the pathophysiological process. And in fact, it should be called advanced stage Alzheimer's. And finally, the fourth stage is the final stage Alzheimer's. And typically, the diagnosis is made at this time. So you see, it is made at the very last stage of Alzheimer's, when the person is already losing or has lost some of their activities of daily living. Typically, by the time you get a diagnosis, the underlying process has been going inside your body and mainly inside your brain for over 2 decades. This is a graphic to just show you what the general belief is. We all have some beliefs about some sort of cognitive decline is normal during aging. However, those of us who work in the field, along with the experts who do the research, so our clinical experience as well as research experience from experts, tells us that there isn't that aging doesn't have to come with any kind of cognitive decline. So the green arrows at the top that you see, which show just a very slight decline, even that doesn't have to be. You can live to a ripe old age with your brain completely intact if we do the right thing, which it is possible for us to do. So the reason we put this up is because in the first column, if you see at the bottom, in the preclinical column, at the bottom of that column, it says this is a stage where the patient knows, but the doctor doesn't. So this is what we want to emphasize today, is that if you suspect something, even though objectively there isn't any measure, or others in your family or in your friends are not able to notice anything, if you suspect something, come in and see us. We can do the test to screen. We can put in a treatment plan that would be individualized just for you. And now you can see on this graph, by the time it comes to MCI, the decline has begun to be very steep. And finally, where the red arrow goes down, it becomes progressively harder to reverse dementia at that stage, although it is still possible, and we are doing it and seeing results with that. Now we want to talk about the prevalence of dementia and cognitive decline. So approximately 2 out of every 3 Americans experience some level of cognitive impairment at about the age of 70. It doesn't have to be like that, but this is where things stand today. And one of the things that Dr. Sanderson loves to say is, let's make this the last generation where the statistics look like this. Let's work with the generation that has progressed to some level with dementia and help to reverse them. And the next generation, which is the generation of their daughters and sons, the caregivers who are now in their 40s, 50s, and 60s, let's help them understand how this works and help them prevent it before it even begins. So that's definitely our passion that we want to follow here at our clinic and want to share with you today. And also for dementia, the lifetime risk for women is 37%, meaning more than a third of women will experience dementia at some point in their life. And we are here to try and prevent that from happening. Okay, this is something very important and near and dear to my heart. I want to talk about this. 2 out of every 3 Alzheimer's patients are women. This is a very sobering fact. So now consider this. We understand that women statistically have slightly longer lifetimes than men, but even then they outnumber men 2 to 1 in the Alzheimer's population. So it's really urgent to acknowledge, to investigate, and to treat Alzheimer's as a powerfully unrecognized and vital element in women's health. There is an expert in New York who works at the Weill Cornell Hospital, Dr. Lisa Mosconi, and she's done a lot of work on women and the aging brain. And what we've learned from research is that when women go through menopause, and we have symptoms like hot flashes, night sweats, disturbed sleep, that is not just the fact that the estrogen has gone away and the ovaries are beginning to slow down their function. These symptoms don't originate in the ovaries, they originate in the brain. So it's really critical for us to understand that how important the hormonal piece is for us, and especially for women, why we are affected more than men. And using PET imaging and other kinds of tests, it has been demonstrated that the decrease in estrogen causes the loss of a very important neuroprotective factor in the female brain. And that leads to an aggressive aging for women, which accounts for why there's 2 out of 3 patients being female. Then we want to talk about the different subtypes of Alzheimer's. Dr. Bredesen has done this work, and what he has done is told us what are the different categories, what are the different etiologies that lead to the development of Alzheimer's. So there are 6 of them. The first one is inflammatory, when somebody has a chronic infection that has been there for years or even decades, and we can look at the inflammatory mediators such as cytokines and chemokines. So that's the first cause. The second one is called the atrophic pattern, and that happens when the hormones are dysregulated. We just talked about for women, this can be a time of menopause and around that. It can also be a thyroid and adrenal hormones that are imbalanced and not able to do the global work in the body as needed. Then there is something that he calls type 1.5, which is kind of has factors from type 1 and type 2. So he averages it to call it type 1.5. And in this case, patients generally have high blood sugar. So a picture of pre-diabetes or diabetes, which can lead to dementia and Alzheimer's. And type 3 is caused by biotoxins, heavy metals, and chemicals. And this is what we are focusing in today's presentation, is one of these toxins called the mycotoxins, or the toxins from mold, which are a really big etiology for Alzheimer's. Type 4 is vascular impairment, when your blood vessels are impaired, and that can lead to amyloid accumulation in the brain. And finally, there can be Alzheimer's associated with a history of head trauma. If you've had a traumatic brain injury or concussion, that can lead to that. Very quickly, I want to go over the genetics of Alzheimer's. There are some genes. There is the ApoE gene, the apolipoprotein E gene, which has been shown to be associated with the development of Alzheimer's. So the one that is most commonly implicated is the ApoE4, which increases the risk of Alzheimer's and is associated with its onset. And about 15 to 25% of the general population carries this gene. The other two, ApoE2 is less common, is actually the least common, reduces the risk of Alzheimer's. And ApoE3, it's the most common in our population and doesn't seem to affect the risk of Alzheimer's. However, having spoken about the genetics, we need to understand that the biggest determinant of dementia is actually how we live our lives. It is not genetics, because genetics only account for a small portion of the risk for developing dementia. The biggest piece is how we live our lives. What are the toxins that we encounter? What is the level of nutrients in our body? What kinds of stresses we are constantly dealing with? Are there any structural issues from TBIs or injuries? And are there any infections? Having said that, if there is family history of Alzheimer's in your disease, in your family, you definitely want to get checked up, because that will increase your risk. And then something important to keep in mind here, those people whose mothers have or have had Alzheimer's, they have an increased risk of developing Alzheimer's themselves.
There may be a component here that's associated with caregiving. What we know about caregivers, whether they're related or not to an Alzheimer's patient, is that they have about a 2.5 times the risk of the average person of developing dementia. And we think part of this comes from the stress of being a caregiver. You're often, if the stress of caring for an adult who essentially behaves like a 2-year-old is extremely high. You don't know when it's ever going to end. And this stress can accumulate over time. Typically, a caregiver is not putting themselves first, so they put off their own doctor's visits. They put off getting good food, exercise, enough sleep to care for their loved one who has dementia. All of these things can impact our dementia risk. And so we care deeply for our caregivers. We thank you so much for the hard work that you do taking on this absolutely torturous disease and caring for your loved ones. And we encourage you to make sure you are caring for yourself. So identifying these risk factors, if they're there for you, doing everything you can to mitigate them ahead of time so that you don't become the one that needs a caregiver.
So here is a picture that we probably don't want to look at, but this is important because this gets into the reason for why we need to screen for mold and mycotoxins. Most of us have seen this scenario, one place or another, at work or at school, at home or elsewhere, we are all exposed to these mycotoxins. So mold is directly neurotoxic. This image is from Amen Clinics, and a lot of neurologists, a lot of researchers at the forefront of this field are writing about how neurotoxic mold is. And even if there isn't dementia, there is a lot of damage that mold can do inside our body, especially within our brain. So these are just some of the symptoms of mold toxicity. And it's really important to see, this is just a small subset of the symptoms, but I just want to read out a few of those: brain fog, fatigue, sinusitis, palpitations, changes in vision, anxiety, depression, overwhelm, allergies, sore throat, trouble sleeping, respiratory symptoms, GI symptoms, hypersensitivity, and of course, memory loss, which is a big one. So we know this is a really big etiology for the development of dementia.
The reason we're focusing tonight on mold toxicity is because in our clinical experience, about 80% of the time, mold toxicity is playing a role. And so we'll take you through a few patients, but we wanted to start, this is hopefully will be the first in a series of webinars where we break down the different types of dementia and the different things that can cause it. Although these causes are not mutually exclusive, you may have hit your head and be exposed to mold. Mold is one of the ones that gets missed most frequently, especially in the conventional community. So when you go to see a neurologist, they're not going to ask you if you've ever been exposed to mold, whether you know it or not. And so this cause of dementia may be missed. And it's also not only just a cause, but it's a very treatable cause. We can get you out of a moldy environment. You can get yourself out of a moldy environment, and then we can help you get the mold toxins out of your body. The first step is understanding if you have them. And so we want to take you through what the process that would look like and make that an opportunity to do tonight.
So, what the intake would look like even if you suspect mycotoxin mold toxicity, or if you're coming in for evaluation and overall screening of dementia, the intake is pretty exhaustive. And we talk about things like, what is your digestion like? What is your gut health? What do you eat on a regular basis? If you can do a food recall of what you've eaten in the last couple of days, what do you need to avoid? Are you allergic to something? What kind of snacks or desserts might you have? How much water, how much coffee, juice, alcohol, soda? All of this gives us a picture of what you're eating, what is the health of your microbiome, and if your elimination, your immunitaries are working well and you are able to eliminate the toxins on a regular basis. Then we want to ask about the exercise, the amount that you've had in the last week. So this gives us an idea of if the exercise is aspirational or if you're actually doing it every week, so doing it regularly. Then we want to talk about sleep. What time did you go to bed last night? What time did you wake up this morning? Did you wake up rested? Have you ever done a sleep study? Or is there any reason to think that you might have sleep apnea? Sleep is such a critical piece of good health, and especially to prevent dementia and to recover from dementia. So it's super important that we focus on sleep. And then hormones. Are there any symptoms? Are you perimenopausal? Are you past menopause? Are you taking any hormones? If you're taking them, are they bioidentical? Continuing on with the intake, we ask about the various kinds of stresses from relationships, work, finances, or at home. Then we ask about your various exposures that might lead to issues. We ask about dental history, whether you have amalgams or root canals or implants, or if you've had any dental surgery or history of infections in the mouth. We ask about exposure to mold or water damaged buildings. Then if you eat fish regularly, are you concerned about, do you know that there is a risk of mercury from fish consumption, and a concern about parasites from fish consumption? Have you been exposed to lead or asbestos in old buildings? Do you have any hobbies that might expose you to any of these heavy metals or chemical toxins? And finally, what kind of travel have you engaged in over the last several years? If you've traveled to the third world, if you had any GI symptoms, we want to know about that. We want to know if there's animals in the house and if they are sharing a bed, because their little paws are bringing a lot of things into the household and into your bed. If you've been camping recently, what kind of vaccinations you've had? Have you had any recurrent infections, UTIs, pneumonias, toenail fungus? What kind of antibiotic use you've had? And if there's any history of trauma. Then we want to talk about preparing for your first visit. As you know, we ask so many questions when you come in the first time, but there is a lot of work to do before you come in for the first visit. You want to make sure, if you are the one affected, that you can bring a loved one with you, a child, a friend, a neighbor, anybody that can come in and help you through this process and be there to ask questions and just shepherd you through this process. So preparing for the first visit, we want your medical history, and you can do this either online through our P2P portal, or you can do it on paper. If you're choosing the paper option, then arrive at least 30 minutes before your appointment time to make sure you can do the paperwork. Bring your list of current medications and supplements. We need to know about any allergies. We need to know who are the specialists or general providers on your team. We want to know your insurance information. If you've had any recent lab work, we'd like copies of that. We talked about bringing a supportive companion with you, and just be prepared that this process takes time and it takes resources, and for those that commit to this process, it makes a big difference. It shows us that you are ready to go through the process, to screen for problems, etiologies, to do the tests that are needed, and to follow the treatment plan that is devised for you.
What we see over and over clinically and in the study that we're currently conducting here is that the more someone is prepared to start the process, the more committed they are to the process, the better the outcomes. It's a lot of work, so we want to be very upfront, but it takes a lot to go through this. However, it's worth it. We see it work, and we're very confident it will work if we are partnered with you and a loved one. Often the patients I see do the best typically come in with a daughter or a son or a spouse who can be there to support them. It's really challenging, although not impossible, to do on your own. And especially if you share a household, because we're asking you to change your diet, we're asking you to increase exercise. Having someone there who can hold you accountable and also support you, to be your cheerleader, to remind you, right? If you're struggling with a bit of cognitive decline, sometimes we forget that we're not supposed to have that cookie. So just having that companion with you for all the visits can be a bit overwhelming. And so we want to make sure that you have someone there to help remind you, oh, remember, the doctor said this about what that lab meant, or the doctor said this about changing your water. Just having that person to bounce ideas off of, to ask, to get that feedback from is so, so important. And coming prepared to these visits also helps you just get the most out of your time with the doctor. So if you know the medications and supplements and you have that all in writing with the doses, how frequently you take them, that's so helpful for us that we can get a gauge on are you actually getting the nutrients? And then when we run the labs, does that make sense? Or is there something else going on with your gut? It's meaningless if we don't have accurate information. So really, really helpful if you can partner with us very actively to collect all this information and come prepared.
Next, I want to take you through the labs and assessments, but I just wanted to take a moment to say, if you have any questions, please go ahead and put them in chat or in Q&A. Once we go through the slides, we will be happy to answer any questions. Okay, so here is the labs and assessments that we run. We will run a full male and female panel. And that includes your general, just your blood counts, your metabolic panel, your thyroid, your other, your sex hormones, the levels of your B12 and iron. There's a cholesterol panel. There is testing for liver and kidney function. So this is basically an overall test that we do to just get a gauge of where your baseline health is. Then we run tests to screen for toxins. We do mycotoxins, which are mold toxins, chemical toxins like glyphosate, and heavy metals like lead or mercury. So these are different tests, and we will talk about the mycotoxin test today. Then we will do a test for a stool test to see if there's any parasites, any gut dysbiosis. Then we will look into a nutrient evaluation for you to see if there are any deficiencies in any of your nutrients that are critical for overall health, for neurotransmitter formation, and different parts of your health. We will do an immune reactivity screening panel to see if there is any concern about a chronic infection, if there's concern about Lyme, if there's concern about any other kind of disease. So this is kind of like an overall check. And then finally, we may do assessments like the MoCA, which is the Montreal Cognitive Assessment. We might do a CNS vital signs, which is an online assessment that checks for global parameters, your processing speed, executive function, and many different variables, and a VAVI, which is kind of like an EEG of the brain. And we can do these assessments at the beginning to see where you are, and also through the process to monitor your progress.
So we're starting tonight with mold, like I said, because it is often missed by the conventional community. And in my clinical practice, in our clinical practice, we see that this is often an overlooked but present factor causing cognitive decline. So like I mentioned, the more comprehensive we can be about testing, understanding the etiology or the why of the dementia, the more confidence we have in reversing it. However, what we've also seen is that even just addressing mold can be helpful in and of itself. So tonight we want to offer you a special, basically we're giving you a discount on a consultation with Dr. Sembi plus a mold test. The reason that we want to screen for mold is because it has such a direct and significant impact on creating inflammation in the brain. It's directly neurotoxic.
Yes. Okay, so now we have 3 cases for you here, and Dr. Sanderson, you will take us through these 3 cases and how these test results correlate with the clinical picture.
So this is the real-time mycotoxin testing that we're offering this evening. And what we see here are 4 of the 5 mycotoxins that we look at, but this gives us a good sense of what's happening. So this is Lou, and Lou came in initially in September of 2020, about a year ago, and his mycotoxins were essentially off the charts. The way that we read this is that this blue line is normal. Under that blue line is normal. Within the blue line is equivocal. We're not sure if that's making a clinical difference or not. But above the blue line, and certainly outside of the gray, this is off the charts. This was one of the highest ochratoxins I had ever seen at the time. And this certainly was contributing, in my opinion, to his cognitive decline. So what we can see is that we started treatment. We've worked with Neil Nathan and Jill Krista and learned from them specifically how to target mold. And so we do that as part of our comprehensive approach to reversing cognitive decline. And this patient was on a comprehensive approach, so he wasn't just addressing mycotoxins. However, his MoCA was inversely related to his mycotoxins. So as his mycotoxins came down, and we were testing every 3 months, every 3 to 4 months here, as these mycotoxins were coming down, we saw that his cognitive function was improving. Now you'll see that this trichothecene came up. So what we often see is as we get better at detoxifying molds and mycotoxins, then sometimes initially there's a little bit of a bump up. What I suspect was happening, because this wasn't, there's just a little bit showing up here. You can see it's very close to this blue bar. So he probably didn't experience a new exposure. This was just a little bit of the mycotoxin just starting to come out that was probably stored in him for quite a while. At this point, when we met, he knew his house was moldy. So especially when we saw this, when we saw the labs, it was confirmation that he probably was being exposed. When we see levels this high off this gray chart, and in so many of them, that makes us suspect that there's a current exposure. That's not the case for everyone, but often is the case. And when we see 5 of the 5 or 4 of the 5 elevated, sometimes it's been previous exposures and multiple exposures to moldy or water damaged buildings. So bringing this down, what we do is typically a combination of binders, so long as they're tolerated, things like clay, charcoal, chlorella, glutathione, and sometimes prescription cholestyramine, particularly for ochratoxin. This patient has, what you'll see is this decline over 5 months, 4 or 5 months here, what we would expect as we start treatment for the most part. However, what you'll see here is her gliotoxin went up. This is also very typical. I can't tell you how many patients I'll see where that gliotoxin starts to come up. Gliotoxin is associated with candida. So if there's candida in the gut, in the sinuses, somewhere in the body, as we start to use binders and maybe even some anti-yeast, whether it's natural like an oregano oil or pharmaceutical like nystatin or diflucan, we'll start to see the gliotoxin go up. And that's because the candida is irritated. The other thing that irritates it is starving it with a ketogenic diet that is the best diet for cognitive function, but also a great diet for getting rid of toxins and getting rid of candida, which causes gliotoxin. So as we irritate that candida, it starts to create more gliotoxin. We can see this in a petri dish. Dr. Joe Brewer did this work and published it. Essentially what happens is if you put candida in a nice, healthy, happy petri dish where it's got the perfect temperatures, all the food that it wants, it does not produce any gliotoxin. So you can have candida if it's in a nice, healthy environment in your gut where it's getting fed sugar all the time. It doesn't produce gliotoxin. And then when we take away the sugar, we start adding antifungals, we start adding binders, that candida starts to fight back and it produces more gliotoxin. So what I would expect is that this patient over time, this will start to come down because we will treat her with some bug killers and there will be less and less candidal burden. And I will continue to use the binders and that will come out. Like Lou, this participant, she is a study participant, she also had that inverse relationship between her MoCA scores and her mycotoxins. So as her mycotoxins came down, her MoCA scores were going up. This is another patient where the same thing happened, where her mycotoxins came down and her MoCA scores were coming up. Here you can see her levels were not off the charts. They were pretty moderate. However, they were still present. So like Lou's you saw here. Here it is. You can see he's off the charts. He's at 19, over 5, 12. So now we're talking about pretty mild levels of mycotoxin, 1.3, 1.2, 0.5, nothing crazy off the charts. And yet getting rid of her mycotoxins was very, very helpful in, I believe, getting rid of all of the toxins, I'm sure, was helpful in reversing her cognitive decline. This is on trend. Although with Dr. Bredesen's approach, we're not piecing it out. We're being as comprehensive as possible. So we don't know to what degree this was impacting things. However, when we see this over and over again, that when we bring mycotoxins down, cognitive function improves, there's probably something to it. And certainly we are testing that in a very formal way with our IRB approved study in the clinic right now.
So as we talked about, that there's different kinds of toxins. There's mycotoxins, there's chemical toxins, and there's heavy metals. And we do screen for all of them. But what we have found clinically is the mycotoxins are the one, they're number one in terms of prevalence. Over 80%, as we said earlier, over 80% of patients have an elevation in mycotoxins, which is why we are focusing on mycotoxin testing today. So At this website, at our website, solsere.com/brain, there is more information on this. What we are offering is a mycotoxin test plus a 75-minute consult to screen for mold. So the full price of the test and the consult is $949, and for a limited time, we are offering this combo for $697. So if you're interested, you can go to this website and put in your details there. What this entails is once you sign up, we will send you the test kit in the mail. This is what you will get in the mail. There on the left is the test kit. The name of the lab is Real Time, and it's called a mycotoxin urine collection kit. And on the right side is a bottle of liposomal glutathione. So we will send you these two things in the mail. And these will be shipped to you along with detailed instructions on what to do and how to do it. So basically what you need to do is you will take the glutathione from the bottle on the right, 1 teaspoon 3 times a day, 5 days in a row. And on the morning of the 6th day, you will collect your urine in the urine collection kit, and you will ship it off via, is it FedEx? Yes, via FedEx to the lab, which is Real Time.
There's a prepaid envelope that you stick it in. It's very simple. You can do it from the comfort of your own home. You don't have to go to any lab. And it sounds a little complicated to provoke with glutathione, but we get much better results, much more consistent results if we do a little bit of provocation. So you can do all of this from home, and all of the instructions will be in writing in the kit, so you don't have to memorize them right now.
Okay, again, this is basically, you see the website, the link is solsere.com/brain. And again, we will ship the kit and the glutathione, which is an antioxidant. And as Dr. Sanderson said, what it does is it helps to mobilize the toxins from your organs into the urine. And then we test the urine, and that tells us which species of mycotoxins are high, because treatment varies by the kind of mycotoxin. If you have ochratoxin, we use a certain kind of binder. If you have a different toxin, we might use a different kind of binder. So what we need you to do is just follow the instructions that we will send to you and send in your urine sample to the lab, and do this as soon as you can, because we will schedule, your follow-up will be scheduled about 2 weeks after your test results, after you send in your urine sample. So you will have a consult with me to go over your results and discuss the plan of treatment.
This is really exciting because typically we have a 75-minute visit where all we're doing is collecting information and we don't have any labs. And so we're giving usually pretty generic treatment plans on the first visit. And when you work with Dr. Sembi, taking advantage of this offer, you will get recommendations specific to your mycotoxin results. Even if what you find is that you have no mycotoxins, that is so helpful to just check that box, be able to move on, and then identify if there's some other factor that's impacting your brain health. So really exciting to have this opportunity, and we can't wait to help you figure out if mycotoxins are potentially impacting your brain or the brain of a loved one.
In the meantime, while you put in your information and are are waiting for the kit, these are some of the things that you can start doing at home. These are global instructions that are applicable to everybody who's concerned about dementia. Reduce your sugar and carb intake. Fast overnight, which means that try and finish your dinner by 6 or 7 p.m. and then try and not eat anything for at least 12 to 14 hours. That's what we mean. Try and not have a late night snack. Reduce the toxic burden. So if you know you are in a moldy environment, either get that remediated or see what other changes you can make to get out of a toxic environment. Definitely make sure you're getting quality sleep. Make sure you get exercise every day. And just walking, we find, isn't enough for this. We need more. So we need you to do some vigorous exercise at least 4 or 5 times a week, and then take supplements that help your brain health. And we can help you with all of that as well.
Even just starting with omegas, we like to use the Qualia Mind supplement. That's a great one that has a complex of brain supportive or nootropic factors. One version has a little bit of caffeine in it, and that tends to be quite helpful. Prevalence is another one. Fish oils, I think I just mentioned. Vitamin D is helpful. That is also a hormone that can help to send those healthy signals to the brain, telling it to make new neurons, new connections, create new memories. So having vitamin D at optimal levels is pretty basic. Also B vitamins. So we can help you fine tune these lists, but in the meantime, just making sure you're checking those boxes. Dr. Bredesen also has a great list in the back of his book. Not all of those are necessary for everyone. So, if you feel like you're swallowing a lot of pills, or you're not sure if this one is necessary or that one's necessary, get scheduled. Let's evaluate that for you. Let's figure out if you can save some money and not swallow so many pills by knowing exactly what path you took to cognitive decline.
This is just a picture of a happy, healthy family. And we hope that this will be your family, 3 generations, and no issues with dementia. You're preventing it, you're being proactive, you are present and around for everybody, and just you're enjoying your life to the fullest.
So we're going to answer some questions here. And there will be we will be having a replay. So for anybody that is concerned, there will be a replay available. The heavy metal testing that we do is not typically provoked. We usually start with the quicksilver heavy metals, and certainly they're known for mercury in particular. We do doctor's data provoked heavy metal testing if there's an indication for it. With elderly folks who, where there's a risk of osteoporosis and also potential depletion, we don't typically provoke with chelation right off the bat. If there's high levels in the intake process, if we understand that there's a high potential exposure risk, then we may do that. The immune reactivity screening panel we do through Cyrex. It's array of 12. There really is not a perfect test for this. There's a lot of them out there, and so wading through this depends to some degree on your exposures, which we would get in that initial intake. So typically we would do, if someone said they didn't have much in terms of exposures to infections, we would want to still do that Cyrex array 12. Oftentimes we'll find patterns of mold or parasites or bacteria. It also includes herpes and P. gingivalis, as well as Borrelia, all of which are known to specifically trigger the formation of beta amyloid plaques. So important to know if that's a factor. And the other testing can get expensive, it can get cumbersome. You really have to ask the question, is it EBV? Is it herpes? Is it? And so this is the best screening tool that I've found so far.
Do you offer non-resident services on a remote basis? We ask patients if they are not in California to see if they can make a trip to California, if they're able to come visit us in person once a year. If you're able to do that, then yes, we can see non-residents. Our license is in California, so we want to make sure that we stay focused here, but we are happy to see you if you can make the trip and come see us.
So Kimberly has a question about trichothecenes from Stachybotrys. Typically that's right, from black mold. Trichothecenes, I don't see that being particularly hard to clear. We see it consistently clear. Chlorella is really important for that one. And sometimes the zearalenz and trichothecenes are a little bit more stubborn than ochratoxin or gliotoxin, but not terribly. Most of the time within 6 months, if you are consistent with the plan, consistency is key when getting rid of mycotoxins. So as long as someone is consistent, typically at 6 months, we're noticing pretty significant declines, just like what we showed you in the patient examples. toxins, mold toxins like heavy metals can accumulate in the body and last a lifetime, especially if you're not particularly good at getting rid of them, or if you've been exposed to a particularly high amount of mycotoxin. So if you left a home 10 or 15 years ago, you may still have mycotoxins in your system that are impacting your memory. So the question, can you tell from testing if you are storing older mycotoxins or if they're newer? Unfortunately, the testing does not tell us if it's current or an old exposure. Now, because of our clinical experience, we do have a little bit of a gauge on that. If I'm seeing mycotoxins in the teens or 20s, typically there's a current exposure. If you're seeing things elevated but around 5, 6, then that doesn't always mean a current exposure, but it can. I'm less concerned about a current exposure if they're a little lower. So there's a few things to parse through there. The other thing that we can recommend is just getting your house tested for mold. So if you're concerned about a current exposure versus a previous one, you can just test your current environment, and that will give us a lot of great information. Karen has a question about the oral pill form of glutathione. Is that just as effective as liposomal? No, it is not. I would not waste your money on oral glutathione. I would go ahead and just save a little bit and get the liposomal, the liquid that needs to be stored in the refrigerator. There's 3 brands that I trust at this point: Quicksilver, ReadyZorb, which you saw a picture of, and then Research Nutritionals to a lesser degree. I don't have as much clinical experience with Research Nutritionals, but they make a good liposomal glutathione. And Kim is asking about Great Plains suggesting that you not use glutathione. I wholeheartedly disagree. I have done this for 7 years. I've been doing mycotoxin testing, and we used to do it without provocation. Great Plains also keeps changing their assay without telling anyone. So I would not recommend doing mycotoxin testing through Great Plains. I would avoid them, and I would recommend doing it through real time. I have seen too many mycotoxin tests that come back negative, and they are false negatives because someone did not provoke. The people who are sickest are the ones that can't get rid of the mycotoxins. And so when you're sequestering them or holding on to them, they're causing even more damage. If we don't provoke, we often will get negative results when there is in fact a ton of mycotoxin in the system. So I know that I'm aware that Bill Shaw at Great Plains suggests this. I disagree.
How much does the follow-up cost? Well, that varies depending on what kind of follow-up we need to do. It depends on your overall symptom picture. What did the mycotoxin test show? How much you've been able to adhere to the treatment plan, and overall how you're doing. We have follow-ups for 40 minutes and 50 minutes. We can even do a 75-minute follow-up depending on the need. And so the price would vary. Generally, at this time, the pricing is all on the website. Should we go through the pricing, or what do you?
Yeah, so if you just go to solsere.com, I believe it's under the Contact Us drop down, you'll see fees, and all our fees are listed there. The significance of root canals and toxicity. I'm so glad you asked, Ronald. So we frequently will refer out to biological dentists, and I think it's very important to have a cone being done, because a lot of people do not realize the impact of a root canal that has a latent infection or a kind of a mild infection underneath it that can harbor P. gingivalis, which, because of proximity to the brain and because of the nature of P. gingivalis, can directly influence the formation of beta amyloid plaques, particularly if you have a genetic predisposition in that direction. So there are times when I'm telling patients, don't come see me, just go straight to the dentist. In fact, I had that conversation today. I have concerns after asking questions about their dental history that if somebody tells me they have 5 or 6 root canals and they're experiencing cognitive decline, I want you to go straight to a biological dentist so that they can evaluate if that is triggering your cognitive decline. Sinus infections as well. If you have recurrent sinus infections or recurrent sinus issues, go straight to a biological dentist and have them evaluate potentially your root canals, but even in places where you don't have root canals, you can have asymptomatic infections, abscesses that are causing significant inflammation in the system. And they don't only impact your brain, they are significantly impact cardiovascular health and can increase your risk of heart attacks and strokes. So very, very important to be seen by a dentist if there's a concern there. So webinar transcripts in your mailbox, I'm not really sure what that question is about. If that's about the summit, you can send us an email and we'd be happy to get you in touch with the support team there.
I think they mean the webinar transcript for this webinar.
This one? Yeah, that won't be available by email. There will be a replay available. So, where is the main clinic where we can be assessed for our risk factors? In Southern California? Wonderful. So the location to come to, we are also in Southern California. We are in San Diego and Encinitas and North County, San Diego, and we would love to see you here in person.
Sometimes I get only 5.5 hours of sleep and I feel very good because I slept so well. Well, that's really good because not a lot of people wake up well rested, especially if they've had only 5.5 hours. It depends on your overall trend of sleep, how you're doing overall on a regular basis, and how you feel in other areas of your life. But if you wake up well rested, that may be okay for you, but I think we would have to evaluate on a one-off basis.
So can mycotoxins contribute to weight gain and thyroid problems? That's great. We were just before we started this webinar, we were discussing exactly this question. And the answer is yes. So our approach to complex chronic disease, of which Alzheimer's and dementia is one, as is thyroid problems, as is weight gain, we think about this in using basically integral theory and complex system science, that imbalance is the real disease. That is the real problem happening. And that means too much, too little, in the wrong place or at the wrong time. And there are 5 things that we really need to focus on if there's an imbalance in the body. If you have weight gain or thyroid problems, that's a signal from your body telling you that yes, in fact, there is imbalance. And we want to address that by getting at the root cause. One of the reasons I was so attracted to Dr. Bredeson's work is because he talks about this incessantly, right? His approach is to identify and treat the root cause. So weight gain is not a root cause. Thyroid problems, thyroid imbalance is not a root cause. These are symptoms of imbalance at a higher level. Toxic exposure or toxic overburden, which is what we're discussing tonight, specifically mycotoxins. So toxins, structural issues, stressors, imbalances in stress, imbalances in nutrients, and then imbalances in infectious burden. So that is really where we want to focus. And yes, any of those things can contribute to weight gain and thyroid problems. They're downstream, they're secondary effects of imbalance in toxins, structural issues, stressors, nutrients, and infections. So that's why we spend so much time talking about those things, and Dr. Bredeson does as well, is because if we can get those things balanced, then a lot of other things, autoimmune conditions, neurodegenerative issues, weight, and thyroid all resolve. So is there a directory of people who test homes for mold from Chan? This is a great question. We refer to etnt.com in Southern California, and then immunolytics.com. They also do a great job. They have Petri dishes. None of these tests are perfect. You'll have lots of people who tell you one thing is better than another, but I recommend doing the Immunolytics Petri dishes. They're low cost and relatively good data that should give you a sense of whether or not there's mold in your home. The appropriate tests at home, one thing to keep in mind when it comes to testing for mold in your home is that there's a lot of different interests in the field. So if you have someone who tests molds and they typically represent a landlord. Their interest is going to be in not finding mold. If you have someone who is more aware of the impact of mold on many people's health, then they're going to be probably a little bit more thorough and more likely to identify if there's a problem. One thing that can be helpful is to look for moisture first. So instead of looking actively for mold, if you look for moisture, sometimes mold is behind drywall, so it's not visible. You wouldn't find it unless you identified that there was moisture there first. So this is kind of an entire conversation. We could do an entire webinar on mold and finding mold in your home. What I would do is refer you to someone like John Banta. johncbanta.com is a great resource for that. He is an environmental hygienist. Also ETNT, the letter E, the letter T as in Tom, AND.com. We'll put it in the, it's auto-correcting, but etnt.com is also a really great resource for information on environmental hygiene.
Oh, you won't do it.
It keeps auto-correcting. E as in elephant, T as in Tom, AND, T as in Tom.com. Amalgam fillings and the impact on memory. And so amalgams have mercury in them. So if you have any metal fillings in your mouth, they can have mercury, and that mercury is directly neurotoxic. If the question goes on to say, comment please if they've been in place for 30 to 40 years, how likely are they to be impacting memory? So the issue here is that 30 to 40-year-old amalgams are probably a problem because they're old. And so they tend to break down. They might be off-gassing more. If you're drinking hot liquids or chewing on hard things, you can be exposed to more and more of that. So you would want to connect with a biological dentist, and that biological dentist will have a safe, or I think it's the SMART way is the acronym for how to take that mercury out, the mercury removal process. Very, very important to do that correctly. The highest exposure to mercury with amalgams is when they're being put in. Can't do anything about that now, but also when they're being taken out. So you want to be sure you're working with someone who is aggressively mitigating the risk of mercury exposure then. And how likely is it that they're impacting your memory? Mercury is a neurotoxin. So if it's present, it is possible that it is impacting your memory. Again, this is a comprehensive approach. So our confidence goes up when we do all of the things, which means we're not taking a reductionistic approach of, is it just mercury? We're saying, is it mercury? Is it mold? Is it chemical toxicity? Is it because you're not getting enough exercise? Is it because your circulation isn't great? Is it because your sleep is impaired? We want to know all of those things and do something about all of them. That's when we have the highest confidence that this approach will work. So one of the things that we do is we use IMD from Quicksilver to detoxify mercury. You can use that with amalgams present. It's not a direct chelating agent, so it's not going to pull more mercury out of your teeth. However, it will start to bring down the total toxic burden at the cellular level. So you could get started on that right away, work with a provider here or with another well-trained provider, Bredesen-trained provider, and have them help you through that process. There's good ways to do it, and then ways that aren't as effective or potentially harmful. Is it possible that a tooth requiring a root canal is minimally asymptomatic, slight discomfort, but no significant pain and nothing more? Yes, in fact, I've had this personally myself. I had a tooth that required a root canal that had an active infection, and I had absolutely no pain or symptoms. And that was because the root was already dead. The nerve had died and I had no symptoms. And sure enough, there was a raging infection underneath it. So I've experienced it myself, and I've seen this happen in patients many times. You do not need to have tooth pain. This is one of the dangers and why it's so underrepresented, is because you do not need to have symptoms for it to be causing a significant problem. So Dan asked a great question. Do you need to stop all supplements prior to collecting urine? So what we do ask is, if you are collecting the urine mycotoxin for the urine mycotoxin test and you are collecting for the second time, you do stop binders 3 days in advance. If it is your first time collecting for real time, then you don't need to stop anything. Just go ahead and add the glutathione consistently 3 times a day for 5 days. If you have an increase in symptoms, you can stop right then and collect urine right away. If you have an increase in symptoms, that means we're on to something. You probably are stirring up some mycotoxins. And if you just go ahead and collect your urine, then we should catch them in the sample. Does mold cause very high levels of oxidative stress? And any thoughts on the connection between hyperthyroidism and dementia? So mold, thank you, Juliana, for the question. Mold can contribute to high oxidative stress. Many things can. Oxidative stress, again, it's kind of downstream. So what we want to do is make sure that we are we're addressing, again, that causal level, which could be mold toxins, could be heavy metal toxins, could be chemical toxins, could be nutrient levels, could be stressors. So when we have those things balanced, the oxidative stress is reduced.
So is a neuroquant suggested at this time? So as part of this test kit and the consult that we're doing, no, that's not part of it. But otherwise, if you're doing a whole evaluation of dementia and or Alzheimer's, we may suggest a neuroquant. The next one is, what is glutathione and can it have any negative effects on your health? So glutathione is an antioxidant and our body produces it naturally itself. But what we are doing with this is it helps to basically mobilize the toxins from your organs into the kidneys and then into the urine. So we use it as a provocation agent to get it into the urine so we can measure it. Are there any negative effects on your health? Generally, people don't report of negative effects, but as Dr. Sanderson was just saying, if your symptoms get worse after taking it for like 2 or 3 days, that simply means the toxins are being mobilized. You don't need to do more, and you can collect urine then and send it off. So in different people's cases and depending on the toxic burden, it may happen sooner rather than later. And so then you might see an effect that way.
It doesn't mean that it's causing irreparable harm. It just means that we're probably on the right track. You can stop taking it. We don't want you to feel worse. And we'll probably need to come back to it at low doses. However, the side effect or an increase in symptoms is just really signaling to us that we're probably onto something. So Sandra is 79 and has been on the protocol for about 2 years. Well done. And is still having some trouble with math and word finding. So one of the tips here is to lean into it. So what you want to do is whenever you're doing your brain games, do them in math and word finding. Also, if you feel, it sounds like you're getting better in some ways. If you aren't getting better, then work with the provider. Maybe get a new provider, maybe follow up with your provider and let them know. But I would expect you to be getting better. If you're not getting better, then we're missing something. And so definitely connect with your Bredesen trained provider and do the testing, maybe repeat it. It could be a new exposure. Something's going on there. Testing ERMI from real time. I'm not familiar with my real time doing an ERMI. Typically, you would have someone come to the house and they would do an ERMI test. Those can be somewhat helpful. They might be expensive. It really just depends on what's available in your neighborhood. Again, the proper mold inspection, I'm going to skip the rest of these questions and just refer you back to John Banta, who can help with the best, an environmental hygienist can help with the best types of mold testing for your home. Our job is to test your body, figure out if it's in your body. If you find it in your home, we can help coach you through a little bit of that, but really we'll refer you back to an environmental hygienist whose their job is to get it out of your home and make sure you're not being exposed.
So the question is, can you detox mycotoxins and mercury at the same time? And the question is yes, especially if we've done the Quicksilver test that we like to do for mercury and we know that your levels are high, we can start treatment for both at the same time. We don't have to do sequentially.
So can mycotoxins be a root cause for Hashimoto's, or is that just the gut? So Kelly, thanks for the question. Isabella Wins wrote a great book on Hashimoto's. I think it's called just the Hashimoto's Protocol, or maybe the 90-day Hashimoto's Protocol. She talks about 3 things, and you'll notice there's a lot of overlap in her suggestions of cause with our suggestions of what the cause could be. So she talks about toxicity, and she calls it kind of like the liver. So the liver is responsible for so much detox. So there's a liver component to her protocol, a gut component, and then a adrenal component, which we call stress. Right, so if going back to our list of toxicity, stress, structure, nutrients, and infections, she's talking about stress, nutrition, or nutrients, and detox or toxicity. So I agree wholeheartedly with her. I would even add the infectious component and potentially structural component like genetics, molecular structure. There does seem to be a genetic component to Hashimoto's or predisposition towards Hashimoto's if your mom or someone else in your family has had it. So can mycotoxins be a root cause for Hashimoto's? Really pretty much any diagnosis that you can come up with, toxins can be at the root cause of that. When you look at the list that comes from Real Time about what the literature, the scientific literature connects mycotoxins to at a causal level, the list is forever long. Renal failure, liver cancer, all types of cancers, of course, cognitive function, brain, all kinds of brain issues, but chronic fatigue, respiratory issues. The list is so long and includes every symptom every system, in the body. So absolutely, can mycotoxins be an issue? Yes. We're talking about dementia in this case and tonight because that's our area of clinical expertise. However, we see mycotoxins associated with many, many more things than that, like the list that Dr. Sembi shared earlier. So there's a question from Karen about, do you know if root canals can be reversed? So unfortunately, no, root canals cannot be reversed. What a biological dentist will usually suggest if you have a root canal that there's a concern about an infection in, is they will pull that tooth, they'll extract that tooth and then suggest either an implant, a bridge, some other, or sometimes a partial denture, depending on what the teeth around it look like. So that can be an expensive undertaking, I am well aware, but getting dementia is much more expensive than having a tooth pulled.
I have a sensitivity to sulfur-containing foods, and glutathione can be high in sulfur. How could I do this test without having to deal with my sulfur sensitivity?
Great question. Yeah, so you can provoke this. It's a little bit less than ideal, but you can also use sweating, exercise, a hot bath, anything that gets your circulation going to provoke the mycotoxins out. So it's not quite as ideal as using glutathione, but it is an option.
Why take binders for bowel collection if mycotoxins excrete the urine?
I think there's a little confusion there. There's no bowel collection for the urine mycotoxins. Yeah, you do take binders because they bind mycotoxins and they do get excreted through your stool. However, that's not where we're collecting and measuring them.
I do not know about the Fix Your Fatigue program.
So IVs for supplementation and treatment. We do offer IVs in the clinic here.
Yes.
And phosphatidylcholine is a common one that we use for more severe mycotoxin sick patients. We also use potentially chelating agents, particularly if lead is high, we will use EDTA in IVs. And if we find on a nutrient plan that you don't have enough of the nutrients that are necessary to detoxify things like mycotoxins, then we absolutely will suggest a nutrient IV or maybe a package of nutrient IVs over the course of 4 to 6 weeks. Now, IVs are not going to get you across the finish line. It's very challenging to get well just using IVs. We love them. They're a wonderful tool. However, they need to be used in conjunction with other things. And usually we are kind of pushing you up over the hump of healing when we are using the nutrient IVs and other IVs.
Mm-hmm. Okay, great. Yes, there will be a replay of this webinar on the solsere.com website. So you'll be able to watch it.
So Dwayne, this is a great question. What percentage of patients are type 1, 1.5, 2, 3, 4, 5? So they're not mutually exclusive. I would say with my clinical experience, we're doing this clinical trial here, and 100% of the patients that I have seen, the participants that we have, and even patients outside of the study participants, 100% of them have some sort of toxicity, whether it's metal, mold, chemicals, or all of them, or 2 or 3 of them. So every single dementia patient I have seen to some degree has had a significant toxic burden. Now, typically dementia patients are a little older, so they've had time to accumulate the toxins. We hear similar data coming out of Dr. Bredesen's work, his trials, and then also out of Australia. If you are looking for these toxins, you will typically find them. So how do you know if you or a loved one has dementia? This is such a great question. The diagnosis from a conventional side, the neurology really waits quite a while to diagnose dementia. It's not until there are really measurable and obvious signs. And so we would recommend that we identify this before it would be diagnosed as dementia, that we would get involved when it's mild cognitive impairment, or even when you're just noticing senior moments. We don't think those are normal. If you can think back to, 10 years ago, I would have remembered that person's name. 10 years ago, I would have remembered that street name or how to get there. And now I don't. That is a sign that your memory is not as good as it was, and we want to intervene immediately. It's really a privilege and a luxury for us to be treating patients who are early on in the disease process, relatively early on in the disease process, because our confidence, the cost in terms of treatment and the work in terms of treatment is so much less, and our confidence is so much higher. So if we can convince you to get in early, it's particularly if you're the child of someone with dementia, let's start now. Let's stop this disease before it starts. You've seen how devastating it can be. So please get in here and let's work together to prevent it from ever happening to you. The specialists that we recommend, neuropsychologists, can be very helpful. This typically, maybe some of you have experienced this, typically you'll go in for 3-4 hours and go through a battery of tests. It can be quite exhausting, but it can help us identify what types of dementia and to what degree the brain is being affected. Specialists like neurologists have, they're varying degrees of helpful. A lot of times what patients will tell us is, I went and saw my neurologist. They either told me that there was nothing wrong, or they diagnosed me with something. They said, get your affairs in order. Here's a drug. It doesn't work very well, Sept or another medication like that. And then they say, come back in a year. They really don't have a lot to offer. So although we wish they did, and we're excited to see them start to recommend, I have seen them, and I'm excited to see treatment notes from Kaiser saying, increase exercise and improve your diet and that kind of thing. Do the Apollo doctors use the Solsere tests? So the Recode training does include, so we're trained by Neil Nathan in Recode, and he's a formal mentor of ours. They're also trained by Chris Shade, and Chris Shade is the owner of Quicksilver, where we do our heavy metal testing through. So they maybe do slight variations of what we do, what we're describing, but all of it is relatively similar because we've all had the Recode training. So is lion's mane a useful supplement? Lion's mane is an herb, it's a mushroom, and it is often in the nootropic formulas. So we use Qualia Mind here at the clinic. And this is, yes, it's certainly useful, but you wouldn't want to use it alone, right? It's a nootropic. It is known to be helpful with cognitive function. However, if we're dealing with someone who has, Alzheimer's, significant cognitive decline, we really want to take this comprehensive approach. The fish oil supplement, that we like the most is called Monopure, and it's by Zymogen, and it is available on our website. If you want to head to solsari.com, you can order it through the Zymogen supplements, so that is available. How does our program compare to Dr. Bredesen's RECODE protocol? So what we recommend is that you are a RECODE participant. So he has a subscription, you can be a RECODE patient. And then what we do is we implement Dr. Bredesen's approach. We are heavily influenced by Dr. Bredesen, and essentially what we are doing is his RECODE protocol in the office. So we'll take a couple more questions and then wrap up. There will be a replay available, and we will absolutely address the rest of your questions, any of those that we didn't get to, in an FAQ session or in the comments. So there's one more question about homocysteine. We measure homocysteine repeatedly with everyone. We want to keep an eye on that. That is a sign of inflammation, and so we definitely want to know where that is. But we haven't mentioned arsenic. So great, thanks for mentioning that. Arsenic, lead, mercury, and cadmium are the most common neurotoxic heavy metals, and we do test for those routinely. Oh, hyperthyroidism and dementia. Juliana, thank you for that question and for reminding us that somehow we skipped over it. Hyperthyroidism in dementia, I see less frequently. Hypothyroidism is much more common. However, hyperthyroidism is out there. What this is, too much, too little, in the wrong place at the wrong time. There's an imbalance in thyroid hormone. So whenever we see imbalances in hormones, they can lead to lots of different problems and symptoms. Typically, what's going on is potentially whatever's causing hyperthyroidism is also causing dementia. Right? These are not causal level things. One doesn't cause the other. However, there's probably something else pushing both the thyroid and the brain out of balance. Toxins, infections, structure, stress, and nutrients. So what we want to do is take this comprehensive approach, be able to get the data, and then analyze what could be influencing both the thyroid and the brain.
If I spread DDT with my hands in the farm for my grandparents when I was a child, would that be able to be detected? That's a great question. The GPL tox does screen for many toxins. I'm not sure if DDT is a part of that. Yeah. Unfortunately, we wouldn't be able to screen for that. But if you know you've had an exposure like that, I would just get screened overall for if you have any symptoms that are concerning. So I would still suggest going through the protocol.
The other thing that you can do to get a lot of toxins out is sweat. So sweating is a really great way. Having a bowel movement every day, drinking plenty of water so that you're urinating regularly, you're not getting dehydrated, you're not concentrating toxins in your urine, you're keeping that flow going. So the five emunctories, our organs of elimination, are your bowels, your kidneys, your liver. So having good liver support on board, much of the liver support like B vitamins, N-acetylcysteine, glutathione, these are actually helpful for your brain as well. So getting those good nutrients on board that support the liver also support the brain. And so we have bowels, liver, kidneys, skin, and lymph is the sweating. So if you can sweat, you can get tons and tons of toxins out in very little time. So sweating regularly helps with cognitive function just because you're getting better circulation. There's studies out of Finland that show better mood, lower risk of dementia when you do regularly sauna. So you get that increased circulation, which is helpful for your brain, helpful for really every organ, and you get the benefit of all of those toxins getting out of your body, out through your skin. If you can shower, take a cool rinse afterwards, and then remember to replace your electrolytes. If you're at home by yourself, don't do this alone. Make sure you have a buddy with you. Make sure it's safe. Don't get it too hot or stay in there too long. But even just 10 minutes of sweating, either with exercise or with sauna, can be very, very helpful in reducing that total toxic burden, whether it's DDT or mycotoxins or heavy metals, whatever it is. And then the last organ of elimination is our lungs. So don't forget that every time you exhale, you're getting some toxins out. So having a good detox breathwork practice, any sort of breathwork practice can be very helpful in reducing total toxic burden. So thank you all for joining us. It's a pleasure to have you. We're looking forward to meeting you personally in the clinic. This webinar will be available for replay. We so appreciate your questions and your attendance, and we'll look forward to seeing you soon.
Yes, thank you very much. It was a great pleasure sharing information with you, and we hope to see you in person or via Zoom.